person on what day surgery is. Most of us know what day surgery is, and most of us, like as Deepak has said, most of us don't know. We just get an idea of what it is. So this is the first day surgery with this concept we have opened in Buddhabari, that is in Tegu. You can visit us someday if you have time. That's the building, and we have rented the top floor only. This is the overview of my presentation. So we'll be talking about two areas. One is just what day surgery is, and the other is what Buddhamai is doing to promote day surgery. First, okay, what is day surgery, in fact? Okay, so the definition of day surgery is changing, like definition of everything else in the world, it seems. In the beginning, day surgery, they said, okay, the dawn to dusk surgery was day surgery. You operate in the morning and you send the patient home in the evening. Okay, so the dawn to dusk surgery was day surgery. Then there came a term called 23-hour surgery, or less than 24-hour surgery, which is also known as extended day surgery. Okay, people thought, okay, you were quite happy with day surgery, then let's extend our concept of day surgery, and they went for extended day surgery, where in fact the patient is admitted for a night. Okay, so that is less than 24-hour surgery is known as extended day surgery. Nowadays the concept again are coming with, along with day surgery, there is a concept of short stay surgery. Short stay surgery, they are defined as you stay in the hospital only for 72 hours, not more than 72 hours. So all the hospitals in the West, they are trying to promote this day surgery and short stay surgery. So there are two types of day surgery. One says day surgery units. So these are based in the hospital itself. Okay, there is a unit, separate unit in the hospital where things are focused on doing only day surgery, where you treat the patient and send the patient home as soon as is possible. Okay, that is within 24 hours. And along with that concept, there are other centers which are known as stand-alone centers. Okay, my center is also a stand-alone center. It is not inside the hospital compound. It is outside the hospital compound. So it can be built where it is needed, like where the patients are, you know. So these are known as stand-alone centers. Okay, and some of the day surgery centers, they are catering to specific problems. Like they have got orthopedic day surgery centers. We can have gastrointestinal day surgery centers, and they are comprehensive day surgery centers. Comprehensive, and we are catering to comprehensive services. Okay, where we provide almost. Okay. Now, why day surgery? Okay. So, in the Western literature also, it is written that the biggest obstacle to day surgery is failure to recognize its benefits. So, we need to know what its benefits are. The benefits. First of all, there have been a lot of studies that hospitalizing small children, they go into psychological effects, even in long term and all. So if you don't need to hospitalize these people, I mean the children, okay, they don't have fear for the white coats and all, you know. In Nepal, if you want to scold a child, you know, doctor can't free no. So doctor means somebody to fear like, okay. So once you attend a day surgery, you know doctor is not somebody to fear, but somebody to love. So, and of course, nowadays everybody is busy, okay, and the benefit of day surgery is that people are discharged home sooner and they can return to their work, of course, sooner. Okay, that is the benefit. And the third benefit is people get individual attention in this sort of small centers. In a hospital is very crowded, not only crowded, but you've got to attend to very sick persons, okay, and everybody is very busy and all, and so people are not really satisfied with the response that the doctors or the medical persons give them. So they want what is a bit of individual attention, and this can be provided in day surgery centers, and that is why this is getting very much popular in the West. Okay, and day surgery centers are not in competition with the hospitals. Okay, they are complementary. Okay, due to day surgery centers, what happens? The hospitals can then cater to the sicker person. Okay, otherwise it's very difficult for the hospitals when you have to cater to not so sick persons and again very sick persons. You know, so they are complementary, and it's not. We should not take it as competitive things. Okay, hospital and day surgery center. And another benefit of day surgery or short stay surgery, there is a virtual absence of nosocomial infection. By nosocomial we mean that hospital acquired infection. You don't stay in the hospital, so you don't have hospital acquired infection. Okay? If you need to stay in the hospital, there are very sick person in the hospital, and not so sick person also will be staying nearby a very sick person, okay, who is infected with some virulent viruses or bacteria and all. So they tend to get that infection. Okay? So there is virtual, and you don't get that hospital acquired infection. Okay? If you get your treatment done in day surgery centers. And there is a reduction in what we call is deep venous thrombosis. Okay? If you are immobilized for more than, like in prolonged bus tours or airplane also, you can get a DVT. There is a chance of getting. If you are immobilized for more than 8 hours, then what you get is a thrombosis of the veins. Okay? So we don't favor immobilization. We tend to ambulate the person as soon as possible. Okay? So that there is a significant reduction in deep venous thrombosis. Okay? In people who have been operated in day surgery centers. Okay? Because we tend to advocate ambulation. And like I was talking with one of the Fulbrighters here, and so everything is driven by financial risk. Definitely nowadays everything needs to be financially viable. Okay? And the benefit of this day surgery is definitely financially cheaper. Okay? The cost in the beginning is a bit high because you need all sort of sophisticated equipment and all. Okay? But for the patient in the long run, it tends to be cheap because you don't need to be admitted. Okay? And the hospital cost saving is. So who should have day surgery? Okay, once we know, so who should have day surgery? Well, previously there were probably only minor surgeries, okay, that was included in day surgery. But nowadays, even with the advent of minimal access intervention, okay, once upon a time, patient with myocardial infarction or atherosclerotic heart disease, they had to go for bypass surgery. Okay, as you stay in the hospital for 10 to 15 days. Okay, now it's 10 days. You stay in the hospital for a day and then be discharged. Okay, so because of this new invention in technology and all, so the surgeries that needed a 21 days, a month stay in the hospital, they can be done in a day and be discharged in a day. Okay, so along with neurosurgery, okay, people can do embolization of aneurysm and all, okay, and the patient is discharged the other day. Okay, so what we want to say is that there is almost no surgery that is not amenable to day surgery. Almost all surgery can be done in a day surgery. In the beginning, they thought, okay, in day surgery will not entertain people over 70 years or people over 65 years. Okay, but nowadays, what we call is the age is not a morphological age, but a physiological age. Okay, it doesn't matter if the patient is 80, but if the patient is ambulatory, patient is fit, then that patient can be operated in a day surgery center. So age also is no barrier. In fact, in our centers, we have been operating on patients of over 70, 78 years. Okay, so there is no age is not a barrier to day surgery. In the beginning, obesity. In obese person, surgery tends to be a bit complicated and all. But due to this, what we will call a minimal access, due to small access holes, and this obesity is also now no problem. So this can be done in day surgery. Okay? So who should not have a day surgery? These are people who have this comorbid condition. Okay? So we don't cater persons with sort of dyspnea, COPD, who needs a surgery, you know. So those sort of patients we don't entertain in day surgery because they may need to be admitted for oxygen, but they may need to go into ventilation and all. Okay, so if you have like patient on dialysis, okay, they need operation, but we don't entertain those sort of people in day surgery. Okay, they are better operated in hospitals. Okay, so if you have got some other conditions other than for surgery, okay, some medical conditions, life-threatening, then it's better that you go for in a hospital. You get your surgery done in a hospital than in a day surgery. Okay, so previously no surgery, like we said, is not feasible in day surgery centers. Age is no barrier. Okay, obesity also is no barrier, but comorbidity is a barrier according to. Okay, so we think of comorbidity if the patient has some other medical diseases which needs a hospital care. Okay, then we do not operate in day surgery centers. So how do